Hello and welcome to The Nation. I'm Elaine Noor Abdullah. Now, January is Cervical Cancer Awareness Month. It's time to talk about cervical cancer, its risks, and how to prevent it. So today we take a closer look at cervical screening, an essential topic that affects the health and well-being of countless women. And despite its life-saving potential, cervical screening faces numerous barriers, including stigma, access, and awareness. So joining us to shed light on these challenges and the steps we can take to overcome them is Dr. Vigneswari Subramaniam, Deputy Medical Director, National Cancer Society Malaysia. Hello and welcome, Doc.
Hi, Elaine.
Dr. Vicky, it's lovely to have you here. We had a really lovely conversation before we started about some of the sort of challenges and barriers with regards to tackling cervical cancer screening. So let me talk about cervical cancer. It is the sixth most common cancer among Malaysian females, yet many are unaware of its risks. Studies also indicate that the uptake of cervical cancer screening remain low at around 35.2% of eligible women. How can we better educate women, especially in rural and underserved areas where it is needed the most, about cervical cancer and the importance of screening, Doc?
Okay, so as you have rightfully put, cervical cancer stands as the sixth most commonest cancer among females in Malaysia. Uptake of screening is still quite poor because there's no awareness, especially in communities that's got no access to health literacy, or communities that still has a stigma towards cervical cancer. Most commonly, cervical cancer has been associated with this thing called sexually transmitted infections or diseases. Therefore, there has been, certain communities of people who refrain from screening. The other side would be, of course, the procedure of pap smear itself being associated with pain and discomfort, so many females do not come forward. This procedure is also heavily taxing on the female. That's a misconception. They feel that it's invasive towards them, so they do not want to do. If comparatively, if you want to do, say, a screening for blood pressure or height or weight, that is much simpler compared to a cervical cancer screening where they have to expose themselves. So this has been one of a few of the barriers that we have commonly faced. Another cause that we have identified is the doctor being a male doctor. That itself has been one of the associating factors, as well as social support from the family members, friends, and significant other. So they have not been receiving sufficient support from the family members to go forward for a cervical cancer screening in comparatively to, say, ECG for heart cardiac screening. That is more popular and more well accepted compared to cervical cancer screening.
Now, this is a huge barrier to overcome because stigma is something that's not easily overcome, but it is the leading cause, or well, it may not be the top, but it's the top couple of leading causes for preventable diseases. And I think this is the important message here. It's preventable, and it's readily available, and it's easy for us to be able to tackle this. Now, what are the main reasons behind these low percentages, besides what you've mentioned? I think I asked you with regards to it being sort of associated with just being a female problem, but I think the support network, more than just female family, males have a part to play as well. What do you think about that?
Yes, definitely, because any sort of screening, if a lady wants to go forward for cancer screening, she needs to get sufficient support from her family members, especially if it's cervical cancer screening, because the process itself does not take, a quick blood test. They have to go through a screening with a doctor, and then they have to lie down on the bed and then do the screening. So she needs to be ready enough to do this procedure. It must be a procedure that is consented by herself, but of course supported by her significant other, which is the family member. The other aspect is some of these women has always linked cervical cancer to be something insignificant, yes, comparatively to breast cancer or other cancers, out there. So when we speak about cervical cancer, yes, there's a lot of advocacy programs, there's a lot of health promotional activities ongoing on cervical cancer, but they do not take it seriously, as seriously as how they take mammograms for breast cancer. But programs are out there. We've got the active LPPCAN screening programs where they can do it for free. So they have HPV DNA testings and pap smears for free. We've got clinic Kesihatan who's doing it and the public sector. We also have private sector doctors doing this. We also have NGOs doing this. So it's just purely a matter of passing out the information so that they take forward and come forward for screening.
I understand there's also self-screening available.
Yes,
How
yes.
does that work?
Okay, so Pap smear is a healthcare professional performed procedure. Comparatively, HPV DNA is a simple smear that's performed by the lady herself. So she goes into the washroom, she swabs, it's like a long cotton bud, she just swabs, so it's almost painless, and then she puts it back into the casing and passes it back to the healthcare profession. That's it.
So simple.
So simple.
It's something so simple.
Yeah.
You can even do it yourself. So
Exactly.
it's nothing to be fearful about. It's something that should be done, and it should be compulsory.
Yes.
And I understand that you also do have a screening program. We'll talk about that later for those who are interested to get sort of the vaccination. That's also available. But let's now talk about what are the potential long-term implications for women's health if this trend continues, because of the low awareness, because of the low prevalence of any significant sort of like manifestation of HPV. People are unaware that they are at risk. So what are the long-term implications that we should be aware of?
Yeah, so you see, number one, cervical cancer is sort of a preventable disease. Okay, if you're vaccinated and if you do annual screening, you can detect it early. Unfortunately, because of poor screening rates, majority of the cases are still being detected at later stages. So of course it's associated with later stage means higher mortality rate, higher complication rate, more expensive treatment costs, more impact towards the lady, because the cervix by itself is an organ which sits in between the bladder and the rectum. So this lady will have significant changes in her daily activities, such as passing urine and passing motion, and she can't go to work. So there's significant impact in her daily activities as well. Yeah.
And you don't have to be vaccinated just after you are sexually active. It can be before as well, correct?
Yes. So, of course, clinical trials have suggested that being vaccinated before being sexually active gives the maximum level of protection. However, we encourage all ladies to come forward for vaccination.
Right.
Yeah.
So essentially, I think what we want to be able to communicate is that if you're not yet sexually active, you still can get vaccinated.
Yes.
And if you are
should.
sexually active, you should get vaccinated. So all ladies, we have the opportunity to prevent a preventable cancer, and this is an opportunity there. Now let's talk about the HPV immunization program. It has made significant strides since it has started. But are there plans to extend these efforts to older women or underserved groups who may have missed earlier opportunities? Perhaps you can share with us.
Yeah, so at the moment, the Leaving No One Behind program that we have initiated under NCSM has been for those girls who have been missing out the vaccination from the school cohort. So it's for girls who are aged 13 to 20 years old who has missed out their vaccinations in school. However, we have also encountered during this entire process, we've encountered females from, probably sex workers, females from the underprivileged areas with no access to healthcare of any sort, no access to any sort of amenities, not only healthcare, basic amenities, no awareness of any sort of infection, including sexually transmitted infection. So there are a few, cohorts that we have faced, and we have prioritized them and given them the vaccination, despite them not being under the 13 to 20 years old, because our goal end of the day is to eradicate cervical cancer, and these women are the one who needs this vaccine, because if we don't give it, nobody else will.
Yeah, and if we are able to reduce one at a time, sedikit-sedikit lama jadi bukit, as they say, right? So let's talk about this immunization program. You've also currently still have an active one going on. Perhaps you can tell us how that works, where can those who are interested to get the vaccination go to?
Yeah, so the vaccines that we have given so far, we've got 13 states and 3 federal constituencies. We have covered about 250,000+. Okay, we've got a little bit more to finish. Yeah, so we've got 2 more weeks. Yeah, so anybody who's interested can come forward to the Cancer and Health Screening Clinic in NCSM and take it. They can just walk in. So we're open every day from 8:30 a.m. to 10 p.m. and there's no charges incurred. That's the most important thing. This is completely free of charge.
Therefore, anyone who's considering, because the one of the barriers is the cost of the vaccination as well. And I think a lot of people have not come forward because they can't afford it, or they have not thought of this being something that's on their list. But now it's available for free. So for those out there who still have not gotten any of the HPV vaccination, you can actually go to the NCSM. It's free of charge. You can walk in and you can, it's a quick procedure.
It's very quick.
And how long does it take? What do you have to do? I think we can see some of the images here. You can see the ladies that are coming in. You have your doctors.
Yes.
All,
This
and
is
you
our
see there's
team.
a man that's being HPV
Yes.
vaccinated as
So
well.
as I shared earlier, for underprivileged communities, this was done in a particular Kampung Orang Asli. So we know that they have no access to healthcare. So we have taken the pledge to vaccinate boys as well, because this is more of a HPV-related cancer aspect. So cervical cancer, yes, is one of the elimination, but we have also taken the initiative to vaccinate boys, because they also transmit the infection to girls end of the day.
So therefore, you have to support your partner by also getting HPV vaccination,
Yes.
not just encouraging the female, but the males as well, because you are also part of that whole equation.
Yes.
Now, should Malaysia consider making cervical cancer screening a mandatory part of routine health checks for women? If so, how could this be implemented without infringing on personal sort of choice?
Yeah, so that's a very sensitive question. Making cervical cancer screening as a compulsory modus, I think it's possible, but we have to consider the sensitivity of certain cultures and their norms, and we have to work around it. Probably we can give an opt-out option for those who do not wish to do it, but provided they have been given sufficient amount of awareness, so the doctor has to make sure that they give proper health talk before this patient opt-out. Something like what we are doing with NIP at the moment for vaccinations.
So there's an option for us,
Yes.
and that's something that for us to consider.
Yes.
I think perhaps a lot of people may want to know what are the options for like opting out and then opting in later. What are the risk factors for doing so?
Yeah, so of course being a female by itself, because cervix only exists in ladies. Those who have been exposed to sexual activities earlier in life, those who have had family history of cervical cancer or any sort of cancers, those who have had history of cervical diseases such as polyps in the past, of course those who have been smoking or consuming alcohol or polygamous activity. Yeah, all this has to come in as risk factors. Yep, and aging.
And aging.
Yes.
I think you mentioned to me earlier, because I've read some studies with regards to HPV infections. Just getting a vaccination does not mean you are not exposed to the virus and you are not infected.
Yes.
But it may not present any symptoms. So a lot of people aren't aware that they are even infected. And there have been also studies that say that the body will also resolve itself.
Yes.
So how do you know when or should you even need a vaccination?
So that's an excellent question, because when we speak about breast cancer, the symptom is very clear. There's the lump or breast change. However, cervix is hidden inside the body, so the female doesn't find any symptoms, so nothing serious related to it. However, the latency period for this carcinogenic virus called HPV, which is a human papilloma virus, and they've got many strains under it which can cause cancer, the latency period is quite high, quite long. So that is why females have not presented with symptoms. So you may be exposed to the virus early in life, but you might present with cancerous symptoms later in life.
And
So
what's that period like?
Probably somewhere around 8 to 10 years. That's depending on the lady's immune system as well. So what we would suggest is, number one, getting the vaccination, because it gives prevention. Second thing is annual screening. So there is a clinical practice guideline to this for cervical cancer screening in Malaysia. So what we would propose, or what we would advocate out there, and NCSM is carrying this out, is for ladies who are 30 years old to 65 years old to do a pap smear annually for 2 years. If it has been consecutively normal, then they can repeat it 3 years later. As comparatively, if they do the HPV DNA testing, that is a self-sampling mode, that can be done once in every 5 years. However, these two things are two different things. Pap smear actually detects precancerous lesion. HPV DNA, on the other hand, detects whether this virus is there or not, because 90+% is actually from this virus causing cervical cancer.
So I think that's also a misconception. A lot of people think that it's quite a regular thing. A lot of women actually go for pap smear, but they do not realize that it does not cover HPV DNA tests. So how do you ensure that they are actually covered when they're doing pap smear? Because there's this perception of pap smear means I'm covering everything that's in my vaginal region.
So you see, the beauty about pap smear is it's able to detect precancerous lesions. So if we are detecting any abnormal changes, the next step is to do HPV DNA testing. So it's not indicated openly, but right now it's already available and it's free. So like the modes I've mentioned earlier, LPPKN comes on board. They have been giving HPV DNA testings for free, as well as Klinik Kesehatan, and CSM ourselves is providing this in collaboration with LPPKN. So now when the lady come in, we advocate doing both. do the cervical cancer screening via the pap smear as well as the HPV DNA. But if they do not consent for the pap smear, that's fine. Do the HPV DNA first. Yeah.
Right, there you go. No excuses. It's available at our national clinics as well in order for you to be able to prevent a preventable disease. Now, what misconception about cervical cancer and its screening methods are most common in Malaysia, and how can they be effectively countered? So what are some of the taboos or misconceptions, myths that we need to bust today?
Okay, so the process of pap smear by itself, of course, is explosive. Okay, so it's probably physically a bit taxing for the lady because they have to expose themselves to the healthcare providers. So it's very healthcare provider based. The more experienced the nurse is, the more experienced the doctor is, the quicker the process is, less painful it is. But right now, everyone out there is quite trained to do it, especially in NCSM, they're quite trained to do it. Average time frame for a lady to do it, the entire process takes about 5 minutes for us. Yeah, and the misconception associated with it is definitely pain, discomfort, and a bit of stigma because they have to expose themselves. So this is where awareness come in. So we will usually do a health talk. Yeah, and this is done in multilingual form, especially for those who are under the communities where they cannot converse in English or Bahasa. We actually change it to their language. We have done materials in Iban language for Sarawak community. Yeah, so we have changed it, and we ensure that a local community leader or someone from the local area is also present to do the advocacy for us. Look, this is pap smear, this is how it's done, this is the process. You might face a bit of discomfort, but fret not, the one who's doing it is a trained person, and you will not feel any pain or bleeding whatsoever after this. The other angle is actually the part where they feel that they might lose their virginity.
Right, okay.
Yeah.
And how do you counter that?
So usually we will just give it back to them. We will just ask them, are you sexually active before? If you have been, then why don't you get yourself screened? If they say, no, I have not been, that's a very sensitive area. We do not want to push them forward for screening unless they stand under a certain risk factor. It has to be consented by themselves as well.
Right. Yeah. And I think with all things, there's always this saying, no pain, no gain, right? Yeah. But it's like discomfort. It's not something that it would last. It's just a temporary
very quick.
Exposure, but it has a huge benefit that you get in the end.
Yes. 10 minutes for a free life of cancer.
For worry-free, hassle-free, and you just have to come back for regular screenings at a certain interval.
Yes.
Now, let's talk about the role of people like us, the media, the role of influencers as well in breaking cultural barriers and normalizing conversations about cervical cancer and screenings. Because I think one of the things that you mentioned earlier, because it is about this perception that it's because it's sexually transmitted, therefore you don't want to expose yourself as if you have done something wrong.
Yeah, so I think influencers and social media should come in to normalize this. Step is normalizing it. Once upon a time, breast cancer screening was also a taboo because they have to expose themselves. Then we came up with the concept of Pink October, where it's normalized. Everybody needs to be screened. So now it's something normal. Okay, we know breast cancer month, let's go for screening. The idea was to create a month where everybody takes their time to go out for screening. So similarly, we should come up with, this kind of things. Normalize this via the social media, via the influencers. Ensure that everybody out there, especially the younger community, gets the message that cervical cancer is not an issue that should be worried about after you're 30 years old, but rather have the awareness from earlier phases of life. Yeah.
So I think a lot of people are associating this with, a more serious, like it's HIV. So if you come forward, you might be isolated. You might be stigmatized in that way. How do you, share that message about destigmatization? Okay,
so number one is normalizing it. We cannot associate this with HIV because HIV by itself, it leads to another spectrum called AIDS. So that is a different topic altogether. Whereas HPV-related illness, if you detect it at an early phase, the treatment is there and it's 100% cure rate.
Now let's talk about the statistics because if I'm not mistaken, I was reading an article earlier from the Malaysian Health Department. It was about very high percentage, 70, 80 to 90% of people will be exposed to HPV in their lifetime. So perhaps you can talk to us about those stats.
Yeah, so HPV is a virus that is common. Okay, everybody stands a chance to get it. However, it leading to problems such as cancer is only if you're associated with the types under the HPV which leads to cancer. There are a lot of brothers and sisters under the HPV group, and most of them does not cause cancer. Having said that, the ones that cause cancer, the topic that we have to see is how heavy is the infection. So if this person is, you know, say they are not immunosuppressed, the immune system is good, they're the prime of their life and they've been vaccinated, then it is not an issue to them. Comparatively to someone else who is probably immunosuppressed at a later phase in life, that is where it can cause issues. That is why we suggest them, the second you are sexually exposed, why don't you go for screening annually, so that if it comes, you can detect it early at the precancerous stages itself.
And let's bust a lot of myths out there. So I've heard, my studio was telling me, some people believe that garlic prevents and fights HPV. Perhaps you can sort of bust some of these sort of like myths out there.
Okay, so of course, dietary changes does not significantly reduce exposure towards any sort of cancer. However, sedentary lifestyle and poor eating habits has been associated with all sorts of cancer, including cervical cancer. That means consuming processed food, processed meat, things like that. Yeah.
The carcinogenic
items, carcinogenic items. So, of course, if you want to prevent this, go for a healthier lifestyle and develop eating more vegetables, fresh fruits in the process.
Okay,
including garlic.
Cervical cancer and HPV is not a vampire. The garlic is just going to fly away. It has to be a holistic sort of like health regime. You know, not just food, healthier lifestyle, exercise, mental
proper
health
sleep,
as well.
mental health,
sleep, drinking enough
this
water.
This is where the social support comes in.
There you go. Go for your HPV screening already. Now, let's talk about roles of schools and universities. How do they sort of play a role in educating young women about cervical cancer prevention and the importance of early screening? And what is being done right now, and what's lacking, and what do you think should be done more?
Okay, so of course, when we speak about the national immunization program, that has been normalized in schools. However, there is a group of students that has missed out the vaccinations. There are also a group of students under the university's college group right now. So probably we can include cervical cancer materials and awareness materials into their curriculum activities, and then they can also take it from there, advocate these young children or adults to become volunteers. And CSM offers active volunteer training programs as well, so they can come in, they can advocate outside. So we have a educate portion and the NCSM where they go out and speak about cancers. So we have to elect student bodies, their leaders to come forward, then they do this training for their co-students. So it's a peer-supported program rather than just supervisor or lecturer doing it. It has to be a peer-supported program in university levels.
Now, I would like to remind people that when you come forward and get your vaccination, help protect yourself to protect others as well. So it's both, right? It's not just the women. It's like COVID, right? If you get a vaccination, you're protecting yourself and you're protecting others as well. So it is a win-win situation. So if you're a man out there, go get your HPV vaccination as well. And women, please. That is mandatory at this point of time. Now, if someone feels hesitant or afraid to get screened, what advice would you give to encourage the next step? Because, you know, I'm sure a lot out there are listening to this and said, yeah, I think I should, but I'm just still a little bit concerned. How would you sort of like, you know, calm those concerns?
All right, so the most important message is get screened, because this 10 minutes of screening gives you a, you know, lesser headache and lesser things to worry about. Screening by itself is usually associated with unnecessary misconceptions. It's not as complicated as it is. It's actually a very simple process. So we at NCSM are here to help you. If they want any favors, or if they want to understand the process, they want to learn more about this, they can also contact us at our hotline, if I may share it, 1800-88-1000. So any concepts related to cancer screenings, not only cervical cancer, they can actually call us and we can advise them accordingly.
And this is the perfect time to take advantage of this opportunity. The vaccinations available for free. I understand from Raj, I spoke to him earlier, that there's Gardasil that's available. So it's one of the really well promoted and really effective vaccinations against the fight against HPV.
Yeah, so we have a few vaccines in the market. So the ones that we are giving is covering a 4 strain. Of course, there's a superior vaccine to this, which is a 9 strain, but it comes with a cost. The one we are giving is for free, and it's a 4 strain vaccine.
And it will be able to protect you up to a certain percentage, correct?
Yes, correct. So ladies who are taking it from the age of 13 to 20 years old, it gives optimal protection. However, we offer it up to 45 years old in selected cases.
There you go. And what are your hopes and goals for Malaysia's cervical cancer prevention and screening programs in the next decade? I hope that we'll be making better strides, but what is your vision for that?
Coming from NCSM, definitely I will speak about 100% eradication of cervical cancer, and hopefully we can work towards that because it's a preventable cancer. Yeah.
There you go. Thank you so much, Dr. Vicky. Thank you so much for your work, your team's work, in being able to help all those out there who have missed out the opportunity, and those who have not taken advantage of it. This is the time now. It's available at NCSM for the next 1 week from 8:30 a.m. to 10 p.m. every day. Walk in, get yourselves covered. Bring your family along. Bring your husbands. Bring your brothers, fathers, whoever that's in your family, in order for us to be able to help Dr. Vicky and NCSM eradicate cervical cancer in the next decade. And today's discussion highlights how important cervical screening is for saving lives and improving health. To everyone watching, remember, taking care of your health starts with you. If you need more information, reach out to the National Cancer Society of Malaysia. Thank you so much again, Dr. Vicky. I'm Eleanor, and we'll see you next time on The Nation for more in-depth discussions and conversations that matter. Bye for now.